Alright, let's look at the next chapter that deals with HIV and AIDS, specifically as far as the documentation and how we handle that health information. One of the most significant issues in the medical record management field is the treatment records of those patients who have acquired immune deficiency syndrome or AIDS, or who are HIV positive. HIV, of course, and you all know this, stands for human immunodeficiency virus. So either of those issues, we have to be very careful when we have that information, just as we have to be careful when we have any information in the record, but there may be more ramifications if this information were to not be kept appropriately or to be released in the wrong way. It has a lot of things that can happen that could be or have a negative effect on the patient. Now, in most states, there is a duty on the part of the physicians and or the healthcare facilities, could be the labs in the healthcare facilities, to report all cases of contagious diseases. These include some of infections, sexually transmitted diseases, these types of things that have to be reported to the health department. This is mandated by law, and this is put as a duty of the healthcare provider and or the healthcare facility. Now, in regard to HIPAA, the regulations do permit disclosure of protected health information if the disclosure is required by law. So what that's saying is that if there is a law on the books that requires that certain diagnoses or conditions have to be reported, then HIPAA says without patient authorization. If they have to be reported by law, then you don't have to have the authorization of the patient to report if it's mandated. Normally this is on the state level. Now, the privacy and security rules of HIPAA provide the same protections for health information concerning HIV and AIDS as they do for any other protected health information. It just so happens that these would fall into the category of contagious diseases or sexually transmitted disease that have to be reported, but in all other instances, they still have the same protection as any other record with any other diagnoses. Now, when we talk about this duty to report, as I said, usually on the state level, there are statutes, which we know are written laws and or regulations of administrative agencies that require healthcare providers to report AIDS cases to the state or local health department. And the reporting will vary. If it's a state law, the law will vary by state and state in regard to, okay, who has to report it? Is it a physician? Is it the lab when a positive result comes back? And also how much information has to be reported. Does it have to be reported the patient identifying information or just the numbers of cases? Those things, that is mandated by the state law. So that may vary from state to state. Now, in regard to disclosure to third parties, other than if it's required by law to be reported, then we have to have the signed authorization from the patient. So this is just restating that in regard to HIPAA and also with the state laws, we're going to treat this information when we're releasing to a third party, meaning an insurance company, another healthcare provider, to anybody else. We have to have the permission of the patient in order to do that. And we have that via an authorization signed by the patient. Now, there is a situation that we would have to consider, and not just with HIV or HIV positive or AIDS patients, but disclosure to those healthcare workers that will be treating the patients. Only those that are involved in the patient's care should have access to know that the patient is HIV positive or has AIDS. So the privacy rule allows for release of this protected health information in regard to treatment of a patient or in the treatment of the patient. Now, lastly, I want to just talk about AHIMA and the recommendations. You'll see in different classes, you've seen these before, they call them practice briefs or policy statements. This is not the law by any means, but our National Association, American Health Information Management Association, does release papers or recommendations on what to do and how to handle certain situations. So in regard to HIV positive or AIDS patient records, AHIMA's recommendations say to develop a screening program to provide confidential testing of individuals and communication of the test results. So there should be a program that if someone is being tested, that information it remains confidential, and also how that information will be communicated to the patient. There needs to be an implementation of a system that ensures that specific, written, informed consent is obtained from the individual and or his or her representative prior to voluntary testing. And also there needs to be a way for there to be post-test counseling that's given to the patient, provided by a qualified healthcare professional. And this is also whether those tests are, if someone comes in to voluntarily be tested, then they need to have counseling both before and after the test, no matter whether the test is positive or negative. When we maintain the health records of those patients infected with HIV, we should maintain them along with all other patients' records in a secure area with restricted access. The term they use is avoid segregation of records. And in our desire to protect that information, we should not treat it differently than any other protected health information, meaning we don't need a specific place and say, well, we're going to lock these records up over here, and we segregate them or separate them from all the other records, because in doing that, it makes it obvious that that is what's on those records, that there are maybe some HIV results or something like that. So we just treat them as we would all records, and we know that we're not supposed to release any information even within the healthcare facility unless it's with the treatment of the patient or for the treatment of the patient. So we don't treat them any differently. We should treat all records with the same amount of care to maintain the confidentiality and the privacy of the information, but we don't treat them in a special way in order to make sure that there's no attention brought to those records, no undue attention brought to those records. Now, every facility should implement clear policies and procedures for disclosure of health information related to HIV, AIDS, and ensure consistent compliance throughout the facility. And the way we do that anytime to have consistent compliance is through clear policies and procedures of how we handle things or how we don't handle things. Also, in regard to HIV positive healthcare workers, they should manage those workers according to guidelines outlined by the CDC and state and federal laws. So if you have a healthcare provider that's HIV positive, there are guidelines from the CDC, and there are state and federal laws on how you deal with that information when it's to do with healthcare workers, not patients, but healthcare workers. And lastly, unless directed otherwise by a physician, coders should only code from the diagnoses listed in the record and never code strictly from the labs, from the laboratory data or the test results. So it should not be coded if the diagnosis is not clearly stated. In your coding classes, you're going to go over the guidelines for coding. If someone's HIV positive, if they're in there for treatment of AIDS or AIDS-related issues, or if that is secondary and they're not in there for any treatment in regard to their HIV status, that they've had an accident and they've broken a bone or something. If they're not being treated for it, then there are different codes and different guidelines on how to code it. But the main thing here is, and this is the case when you're coding, you don't just code from the lab work. You have to get the diagnosis from the physician or the diagnoses from the physician. So that was briefly a summary of maybe how we have special considerations when we do have records on someone who is HIV positive or has AIDS. The overwhelming number of guidelines here or suggestions are that we don't treat them any differently than we do any other patient record or any other protected health information.